Hi, I'm Dr. Lee Sheldon. From time to time in the media we get, some of the information, but we don't get all of the information. And there are a couple of famous doctors, one of whom you see on TV on a regular basis, who commented, and you saw those comments if you read some of your local newspapers. So I want to cover some of those comments a little bit, and then I want to give you an idea as to really what we as periodontists look for, and actually what you as a patient should be concerned about when it comes to periodontal disease. So the question is this, and this is coming from a patient who writes in to these doctors. I've been diagnosed with periodontal disease. I want to reverse it ASAP because I hear it leads to more problems than just tooth decay. What's my next step? Well, number one, periodontal disease does not lead to tooth decay, so there's no correlation there. But then what's my next step? And of course, the writer says you're smart to want to get control of your oral health. Your timing is great too. There's breakthrough research that's discovered a pretty simple way for you to reduce gum problems and cut your risk for several major diseases in the process. And what it does is to talk about anti-inflammatory things that we can do for ourselves, and certainly we can get better exercise, and we can take care of ourselves, and we can take certain antioxidants in order to be able to help us, and that's good as far as it goes. But when you have periodontal disease, there are other things that we need to look at, and the main thing that we look at in periodontal disease is the accumulations of bacteria and hardened bacteria on the root surface. That unfortunately isn't even covered in that article. Because when we have hardened bacteria on the root surface, it stays there and becomes a nidus, or becomes a central focal point for the loss of bone support for the teeth. And that's really what we need to focus on. And that doesn't mean that we shouldn't do all of the things we need to do for our health. We should. We should get exercise. We should have fresh fruits and fresh vegetables. We should do all of the good things that you already know you should be doing. And if you don't know that, then by all means, you should consult somebody in order to be able to take care of your health. Because taking care of your general health will take care of your periodontal health. And we also know there's a relationship between periodontal disease and your general health. And if we solve the periodontal disease problem, we can help you with your general health. But let's talk about this calculus, this hardened bacteria that's on the root surface. No amount of good oral hygiene or good nutrition is going to get rid of that calculus. The only person, or the best qualified person to get rid of that calculus and remove that, is a periodontist. A periodontist knows and can feel and can sometimes see that bacteria, can see that calculus, and get that out. I want you to picture something for a second. You probably own a house, and maybe you have gutters. Let's think about those gutters. If those gutters were filled with leaves and the water was no longer draining through those gutters, what would you do? You'd clean the leaves out, right? Well, we can say, make sure that it doesn't rain too hard. Let's make sure that the rain is of good quality. Let's make sure that we clean our roofs on a regular basis. But if those gutters are still filled with leaves, we're still going to have a problem. That's how we have to look at periodontal disease as well, at least in this particular instance. We have to make sure that the bacterial accretions, the accumulations of bacteria on the root surface are gone. Because if the accumulations of the bacteria on the root surface are gone, the body then wants to accept the tooth back. And if bacterial accumulations stay there, then pockets form and pockets stay. And as those pockets get deeper and deeper and deeper, the tooth comes out. So by all means, follow all of the nutritional advice you can get. Make sure you're eating good, healthy, fresh fruits and fresh vegetables. Organic, preferably. Make sure that you're following all the directions of your healthcare provider, of your physician, nutritionist, or anybody who's really knowledgeable about nutrition. By all means, read books about nutrition yourself. But when it comes to periodontal disease, make sure you're seeing a periodontist and make sure that bacterial accumulation is identified and it's removed. If you do that, you have a very good chance of saving your teeth. I'm Dr. Lee Sheldon. Thanks for joining me.